Hello and welcome to the Multicultural Media Online Conference. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service and moderator of this session. Thank you very much for joining us. This session is hosted by the Multicultural Health Communication Service, the Ministry of Health, and with the help of Multicultural New South Wales. We have with us joining this special session that we're putting a focus on how we all prepare for summer. You might have felt the heat already in the last few days, but we are expected to have hot weather information as well. We're providing on fire protection. New South Wales Health is reminding people to take precautions to protect their health as hot weather and heat waves conditions are forecast for New South Wales. We've asked today our expert speakers. We're providing key information and tips. We have, of course, Dr. Jan Fizzell, Senior Medical Advisor of New South Wales Health, and also from the Office of the Chief Health Officer. Thank you, Jan, for joining us.
Nice to be here, Jess.
Thank you very much. And of course, we also have Dr. Stephen Conaty, Staff Specialist of Public Health Unit at Southwestern Sydney Local Health District. Dr. Conaty, thank you so much for joining us here today.
Pleased to be here.
We have some very important questions and information to share with you today. Please make sure that you have your questions and put them on the chat. But before we start, we'd like to begin by acknowledging the traditional owners and custodians of the land from which we are all meeting from today. We are joining you from the land of the Camarago people of the Eora Nation. We pay our respects to elders, past, present, and extend that respect to Aboriginal colleagues and community members who may be joining us today. We also pay respects to leaders and community members of multicultural and refugee communities in this session. I'd like to also ask you to join, who are joining us online, to please put your name or your organization or media outlet from which you are from, and also add where you are joining from today. So we have a lot of information to share, and also that will be put on the chat for you. But let's start with the questions. Dr. Jan, you are here to give us some information about heat, but also COVID information. There's a few cases out there.
That's right. So people may have realised in their own family circle, people they work with, their kids at school, that COVID cases are certainly on the rise at the moment. So it's important that we, remember how important it is to keep ourselves and others safe from COVID-19. So if you're sick, stay home. Make sure you stay home until your symptoms are resolved. So they could be a runny nose, could be a sore throat, could be a fever, could be a cough. They should be gone before you go back out and start socialising again. Avoid large gatherings and crowded indoor places if you're unwell, and also if you are vulnerable to more severe illness. It's important to start thinking about whether you put your mask on again. Also, when you are not well, please don't go and visit people in hospital or aged care. Your COVID can go with you and they really don't need it. And do talk to your employer about when it's time to come back to work. If you don't have flexible working arrangements, it's really important that we don't spread it in our workplaces or at school. We need to remember that you can stay infectious for up to 10 days after testing positive for COVID-19. And so that's why staying at home and staying away even from other people in your household remains important. You may also start to wear a mask yourself, or you may see other people wearing a mask. Please remember to be kind to people. Wearing a mask is a reasonable precaution to be taking, and particularly because that person may be trying to protect other people. So please do look after people wearing masks. And again, really, if you're going into hospital, aged or disability care, do think about putting that mask on. They may not require you to, but putting that mask on can help protect other people, because remember, you can be infectious with COVID before you actually know you've got the symptoms. So please, with COVID cases on the rise, let's try and look after each other. We know how to do it. We've learnt those lessons. Let's put them in place again.
Thank you, Dr. Janet. And Dr. Conaty, it's only spring, but we've already had some really hot days, and the Bureau of Meteorology are predicting a very hot summer. Can you tell us what we can expect, and how can this hot weather really affect our health?
Yeah, sure, Jess. It's you're right. It has been it's been a very hot start in early spring. So we had a really hot September. Some people might remember that, and so which was hot globally. But yeah, Australia's going to be hot this summer, and it's going to be drier as well. and we would expect to have more heat waves and hot weather days. And so heat waves are important because, they can, unfortunately, and they do, end up with people getting very sick and unfortunately dying sometimes.
So there are heat-related illnesses that can be related to heat. So I think it's just important. What are these illnesses, Jan, Dr. Jan, and how do we protect ourselves and to take care of our families most of all?
So the most important illness to be aware about is heat stroke. It's actually a medical emergency. It is when your body stops being able to actually cool itself. So you may find that somebody who's been out in the sun or has been very hot is confused, their speech is slurred, they can be very agitated. You might be asking them to sit down, have a rest, and they just won't be able to stop doing what they're doing. When it's more severe, they can lose consciousness, they could have sweated, or they may have actually been sweating and now not sweating anymore. That's actually a more severe sign. They could be having a fit, rapid breathing, quick and strong pulse, and a very high body temperature. And as I say, that's a medical emergency. It's a matter of calling 000 for that person. Heat exhaustion is when we've been out in the heat and we can't keep up with our water and salt intake, and particularly our water intake, which is why it's very important to stay hydrated and to try and work out what time in the day we're actually going to do physical activity, because if we do it during the heat of the day, we're more likely to suffer from heat exhaustion. And again, that heat exhaustion is that stage before heat stroke. So it's a warning to you that it's time to stop and to be looking after yourself. So you may have developed a headache, that you may be feeling a bit sick, not like eating. You may actually start to vomit. You could be feeling dizzy or faint. You just could be feeling generally lethargic and not like you wanted to do anything. You'd be really thirsty and you can start getting some cramps. The other thing is you may not be going to the loo. So if you're a person who normally goes to the loo a couple of times a day, and one of the things that we do often is tell people to look at the colour of their wee. If it's getting dark, you probably haven't been drinking enough. You want it to be as clear and pale as possible. So they're all indicators that you should be looking after yourself better, having a rest, getting out of the sun and trying to feel better. And heat cramps, heat rash, inconvenient, not nice, telling you that you've done too much in the sun. So get out of the sun is the answer.
Wow, those are a lot of symptoms and things to be cautious of. And it's really interesting because a lot of people, when they're walking, they don't realize that they have rashes, and it just takes over, and it is part of the heat.
Well, that's the thing, I was away earlier this year and I came out with, this amazing rash, and it was like, that was telling me I'd been out in the sun too much. So you have to really listen to your body when it's telling you to slow down. I've been out with the Cub Scouts recently, wasn't necessarily watching my own intake, making sure and that's one of the things that happens to parents a lot. They make sure their kids are okay and they forget to look after themselves. And it's just that thing. I started getting a headache. I didn't feel well. I thought, I've overdone it. It was my time. And I wasn't as useful to everyone else as soon as I took myself out by not looking after myself. Yeah. So it's important to look after yourself.
Yeah, and that's right. Dr. Conaty, are there people who are more at risk of these heat related illnesses or symptoms?
Yeah, there sure are. But it's probably worth just repeating that anyone can get into trouble during hot weather. So even very fit and young people, if they're out in the sun or out in really hot weather for too long, and maybe they've not taken the right sort of precautions, and maybe they've been trying to be physically active, then they can get into trouble and start to develop some of those symptoms that Jan described. So, but there are some people who we probably are more at risk and need to take some more precautions. So older people who are over the age of 65 probably are not so good at regulating their own temperature. And so if they're exposed to really hot temperatures for a prolonged period of time, they may get into trouble a bit sooner than people who are maybe younger and fitter. So they need to take more precautions. And the same thing is true for babies and children. They're not so good at regulating temperature, so we need to take a few more precautions with babies and young children.
Yeah, and I guess when you said, Dr. John, when you mentioned that, you have to, some parents were not they're taking care of their kids, but not taking care of themselves. You have to make sure that you're always making sure you're regulated, isn't it?
That's right. And also, if you're pregnant, if you've got an existing medical condition, particularly if you've got a heart condition or you've got a breathing condition or a kidney condition, they're things that can all make it more difficult for you to regulate your heat. If you work outdoors, as Dr. Conaty said, it's very easy to be out, and particularly if it's been a mild night and the day gets very hot very quickly, to not realise that you're actually out in a very hot day. People that we also need to check on who may not have as much access to cooling spaces or may not have as much options about being outdoors. So people who are socially isolated, people who are homeless, that we need to check in on our community. So heat is not just about looking after yourself or looking after your kids or looking after the relatives that live with you. Heat is about looking after your community. And it's only by being a community that we can really beat the heat.
Yeah. So, Dr. Conaty, how can we prepare our own homes? That's, you're saying, yeah, you have to protect our community, but our own homes, and also help those of our families who may need support.
Yeah, sure. Like that's a really good question, and there are some simple things that we can do with our homes. Some of them we need to plan in advance because we can't do them overnight. So we should be trying to. Well, it's really nice to have an air conditioner where's your home, and that's probably the best protection from the heat that we can get. But not all of us have air conditioners. Not all of us can afford to run air conditioners all the time. But check that it's working, and the same thing with your fans, and so they're important for protecting you during those really hot days. Now, covering your windows, especially your west or north facing windows, is also very important. So blinds or curtains can be effective, and sometimes even simpler things that you can stick up on your windows to try and reflect back that heat can be cheap and effective, and that's very important. Perhaps you don't have permission from your landlord to have to put up curtains, so they can work. So they're things that you need to think about, now for the hot days to come in summer. But there's also other things that you might think of that maybe just before it starts to get really hot. So you might think about, okay, well, where is that cool place that I might need to go to? How can I, what's that list of numbers for relatives or friends? Yeah. And equally, if you know about an older person or a socially isolated person, then maybe, and you need to just go and check on them and see if they can, they're making taking some of those steps to protect their home and know what to do. They should also, other things you can do to prepare is make sure that you've got all those scripts filled so that you don't need to make a journey out when it's really hot. And maybe you should do some of the shopping beforehand. Now, it's difficult to plan all things in advance. And so when it comes to really hot weather, you may just have to be very sensible and make sure you don't go and spend too much time in the heat of the day, do your shopping and errands in the morning or evening. So, but those things particularly that you can do to your own home can be really effective. I should say that having a cool bedroom is probably one of the most important things. If it's been very hot and you need to get some relief, and that's important so you don't run into too many problems. So paying special attention to where you sleep and having either that room air conditioned or having a fan can be really important.
So it is really forward planning and finding the coolest place in the room and making sure that you know where it is, and also just being prepared, as you say. I mean, now it's not so hot, but it will. I think that the caution is it will get really hot in some days.
Yeah.
Yeah, I think that what you said about finding the coolest place in the house, I think is important, and so maybe there might be a room in your house that's not your bedroom that might be the coolest room in the house, and so you might just have to think about, okay, well, can we sleep in that room instead?
Yes.
Or think about the person in your family who might be most at risk of maybe developing some problems during the heat, and maybe they should be sleeping in that room. So it's all sort of common sense, but you just need to think about it beforehand.
And it is planning, because sometimes, if it becomes, if it gets really hot at night, and you should have planned that the day before, then it'll help everyone. We have a question here, and also if there are any questions you have, please put it in the chat, because we have experts here. Kim is saying, what methods and strategies would you recommend for district staff when doing community outreach with homeless people to help this cohort stay cool in the summer? Dr. Jan.
So one of the things is to talk to them about where the safe places are to go to get cool, and they're not all expensive things. There are libraries, there are shopping centres, there are places that are air conditioned, that are accessible, that are really important. And so it's about helping people navigate where a place is that they can go that is likely to be cool. It's about talking with them about how to stay hydrated and where water supplies are and how to access water, and also how to ask for help and reach in for help when they need it. It's a really tricky thing if you don't have a place to go, but it is important to know that there are public places to go where you can stay cool, and it's appropriate for you to go there.
Dr. Conaty.
Yeah, I think it is a hard question, and often homeless people, perhaps are not welcome in all places that are air conditioned. But I think we should be trying to provide those places for them, and so that's part of the planning that we should be doing as local health districts, health services, as NGOs, as other bodies. What can we really do to make sure there is a safe place for people when it is really hot? And often in their network, homeless people will be able to think of a place they can go, and we have to make it easy for them to get there.
Thank you. And Dr. Jan, what are some of the things we can do on a personal level to prepare for the hot weather?
Look, I think one of the first things that we should do is have our own health plan sorted. So first of all, knowing how to call Health Direct and using the TIS line to get in touch with Health Direct if English is not your first language or you're not confident speaking with a health professional, because TIS will put you in touch with Health Direct if you need it. Health Direct itself is a good place if you're not quite sure what to do. Am I just hot or am I starting to get unwell? What do I need to do? Health Direct's a fantastic resource for calling people. If you're on medicines all the time, talking to your GP or whoever prescribed those medicines, or to your pharmacist about, do I need to change how I take my medicines in the heat, or is there anything in particular I need to know about my medicine? And there are some medicines that we know that hot weather can cause more problems with. So it's important to talk to your GP about those medicines. It may be about keeping on with those medicines and being careful, or it may be about changing the dose of those medicines in very hot weather. But your GP or the doctor who prescribed those is the right person to give you that advice. The really important thing, though, is having that plan for your family or your community. And that means having that conversation before the hot weather hits, because I don't know about most people, but I know in my family, the older people are always reluctant to leave where they feel safe and secure to go to a place that's got air conditioning, for example. So if you've actually had that conversation as a family, it's not a surprise when you can point to, look, Mum, it's going to be 35 degrees and 20 degrees overnight. It's not going to get cool overnight. You need to come and stay with us for a few days. Yeah. Having that plan in place means it's not a shock and an argument on the day it's happening. It also means you're not trying to move an older person on a very hot day. It's a really good idea to put that plan in place beforehand. And if you do have someone who's reluctant to move, or you don't have enough space to have someone over with you, ringing and checking on them a couple of times a day just to make sure that they're doing okay. And if you've got a younger, fitter member of the family who can go out and get supplies, making sure that those younger, fitter members of the family or the community are out there looking after older people. So if they haven't put in the food or they haven't put in the medicines, or they didn't realise they were going to run out of this tablet today, instead of them feeling like they need to go and catch the bus and get on and get things done, having other members of the community willing to go and pick things up for them is really important. Food can get really iffy on hot days as well. So being really careful about what you do with food.
What do you do with food?
Is really important. So
Don't
making
keep that
sure
on
that
the
your
table.
fridge works, make sure that your freezer works. And if you've got a thermometer for your fridge, they're really not very expensive and they're often handed out at community days. Making sure that your fridge is actually cold and that you're not leaving food out, particularly not to defrost on the sink. That's one of the ones that are really good way of making sure that everyone gets food poisoning. So being really careful with food, and, you know, the Food Authority has got some really good hints for, you know, handling food. And if you've got like a big picnic or something for your family coming up, because, you know, we're starting to move into family get-togethers before Christmas time, it's really important that you're all thinking very carefully about keeping cold things cold and hot things hot.
I was just checking my refrigerator yesterday, and is it cold? Is it cold? But that's a really good tip. You want to make sure that it's ready, and also water.
That's the other thing.
If water, like the water in your car, if it gets really hot, you should be replacing them.
Well, that's right. And so having things like, you know, having a bottle of water in your car, particularly if you're going for a long car journey, the first day of hot, I still remember coming down from Newcastle to Sydney on a really hot day, and the number of cars that are broken down beside the road. And on that hot day, you want to make sure that you've got water in your car, particularly if you've got young kids in your car with you, making sure that you've got something for them to drink.
Yeah.
That you don't leave the kids or pets or anyone in a hot car, even with the air conditioning going, because the air conditioning can stop. So don't leave people in cars. That's really important.
Yeah. And that with water safety, I think that's important. And food safety, as you said, the food that you may have in your fridge and it's not cold, and also being prepared. I am prepared. I have a fan. That's important.
You can be on a train and it can stop. And it can stop for an hour or so. And if you haven't got something to sip on or a fan, you can feel very hot sometimes. So it's about staying safe, and it's about thinking about what you're doing. And, you know, we're not all lucky enough to have air conditioning. And I certainly didn't have air conditioning for a long time growing up. And so it can be about going to those public spaces that don't cost anything to go to, like the shops, like the library, and just hanging out there, or saying hello to friends. Great time to visit people, as long as you can get there and get home fairly easily, and go and sit in somebody else's nice air-conditioned home for a while.
And you were saying, Dr. Conaty, this is, you know, maybe simple, but it is effective.
Yeah, it does work. But certainly, and it works in that beautiful way. Like we have got this fantastic mechanism of cooling down, which we have a little bit of sweat forms, sometimes invisibly of our body, and we just and that evaporation from the fan just works beautifully. So it gives you that lovely relief. You just can't do it when you're asleep at nighttime. So you need to think about having a standing fan or some or air conditioning if you can afford it. Yeah.
Yeah. So I guess, Dr. Conaty, what do we do? What do we do now with all this, with the hot weather coming up? What are the tips that we recommend just to stay cool? And also, I think also there's the risk of fire because of the heat. How do we prepare ourselves?
Well, it's important to be able to listen to warnings. So there's lots of different ways in which we can get warnings about hot weather, and usually it's hard to avoid them. But do pay attention. Now, what people tend to do is that we're creatures of habit, so we just continue to do what we were planning to do maybe a week ago, and not thinking, oh, it is really hot today, isn't it? So, and we did a little follow-up study where we contacted people who had been admitted to emergency departments with heat illness, and just to find out the circumstances. And it was surprising how many people had just done ordinary things that they probably shouldn't have done, like mowing the lawn or painting or doing some household chores or gardening. Wow. And during really hot weather, and they've got into trouble. So it's important to plan. Don't do that that thing that exposes you to really hot weather, make a different plan. Plan to do it at a different time of the day. Plan to do it on a different day if you can. So, because physical activity in really hot weather can be a real recipe for trouble.
Staying hydrated, right?
Staying hydrated is important as well. So that'll help prevent you getting into trouble as quickly. But if you can avoid that exposure to that heat and work, then that's gonna help.
And I know that also, you know, when you have pets and your dogs, and when you walk the dogs or the pets, make sure that they're also safe.
Yeah, not that we're veterinary experts by any stretch of the imagination, but even thinking about how hot is the pavement that either my kids are about to run across or that my dog's about to walk on can make a difference, because very hot pavement can also burn. So it's really important that we're just really quite careful on those very hot days, because it's very easy to actually wind up with problems. And even walking the dog in the heat is not good for you. So again, think about it. Can I do it earlier in the morning? Can I do it later in the evening, rather than being out at my usual time?
Yeah. That's right. And Dr. Jan, we've heard about heat and impact and how it can have on our health. Bushfire smoke's also something that can impact everyone.
That's right. So it's really important that during summer, just like any time, we've got an app called Hazards Near Me. It will tell you if there's bushfires nearby. It'll tell you if there are floods nearby. It's very good at helping us with understanding it. Also, you can get notifications on your phone or to your email about what the air quality is like. And that's really important, particularly if your members of your family have got respiratory disease or heart disease. When we know that the air quality is really bad across a lot of areas, you'll hear from New South Wales Health saying, please stay indoors. And we've had that when we've had really bad bushfires around and where the smoke just hangs. And that's because for anybody, it's not a great idea to be out in that sort of area. But making sure that your or your family's asthma management plans are up to date, that you've got your preventers and your relievers and you know how to use them. And particularly, again, we're traveling a lot at the moment. We're going away from home, making sure that we take things like spaces and so on with us, because even people who don't normally have asthma problems can suddenly have a problem when the air quality is low. So there's lots of ways. I mean, like, I'm very lucky. I've got a watch, and on my watch it tells me when the UV is high. That's great, because I know that I shouldn't be out and about in the high UV. It can tell me if it's, I get warnings on my watch. It can tell me if the air quality is about to be, you can get it on your phone, you can get it on your computer. So it's just one of those ways of staying prepared. And that Hazards Near Me, again, if you can see that there's fires and problems in an area that you are thinking of traveling to, travel somewhere else while that's going on, because you're less likely to have disrupted plans, but you're also less likely to wind up in a bad place. And then if you live in a bushfire prone area, talking to your RFS and getting your house ready just as normal, and making those plans as to whether to stay or go. And when you're making those plans, making sure that you've got essential things like your medicines, management plans, all those sorts of things ready to go with you if you do need to evacuate.
Yeah. Thank you so much, Dr. Jan. And Dr. Conaty, being from a Southwestern Sydney local health district, and if depending on where your local area is to reach out to the local services.
Yeah, that's right. So there's lots of sources of local information that you can find. So you can often, your local council is a good source of information, but nowadays there's a lot of information that's available online with apps or on your radio. Now we've got to remember, of course, that not all members of our community are able to access those things, so there's translated material sometimes, but also there should be messages that come over community radio in your language. Yeah.
And that's right. Juanita Purcell Lolly is just saying that she presents at the Multicultural program on radio on NURFM for an hour each Sunday in her language, in their language. And that's one way to inform the community. And thank you for the Multicultural media who are online. There will be information in New South Wales Health website with on the heat resources that will be available in languages. So that will be sent through to the stakeholders, to the media when they're ready. And please check the website. But you're right, there are resources like the multicultural media who are able to share this information.
And also having that same thing that we did with COVID, where you have someone in your household, your family, your community who's digitally literate, and they can send those messages to other people. So if you know that it's a hot day and you know that there may be people that you know who don't listen to the radio or who are much more absorbed in their home country's news, then reach out to them and say, you need to know about this going on, because it's something that, you know, when I'm overseas, I know my husband spends all his time listening to the ABC News, so we could have a tsunami outside and we wouldn't know about it. So it's really important that, you know, if somebody's able to make sure that other people in the community know that something's going on, not just through the media, although the media is so important and we're so grateful for your work, but just that sort of community person who says, hey guys, it's hot tomorrow, get your heat plans happening.
Yeah, and trusted sources are important. And,
Exactly.
And we have resources that are on the Multicultural Health Communication Service website for health information, and also on New South Wales Health. But we've run out of time. Thank you very much for joining us, Dr. Stephen Conaty. Any last words you'd like to share with the media, with the health and community workers online?
Just a general message that, you know, that hot weather can be dangerous. But if we do the right thing and we take special precautions and we're careful, then we'll stay safe.
Thank you, Dr. Conaty, and thank you for joining us, Dr. Jan.
And just remember to keep an eye on air quality through the summer, and also with COVID coming back, making sure that you protect yourself and those around you by staying home if you're sick.
Thank you very much, Dr. Jan, and thank you to you all for joining us today. It has been a very informative session. We provided tips, and as mentioned earlier, there will be translated resources, multilingual information and videos available, and we'll share that with you. Meantime, please share this recording that's going to be available of this session to your communities. It'll be available on the Multicultural Health Communication Service website and New South Wales Health social media pages as well. And just like me, I have made sure that I'm prepared with a fan. So take care of yourselves, keep cool, stay safe. We'll see you again next time.